every day I try to think about like, what are the good things we are doing? What are the positives that we are bringing? Okay, let's keep doing those. Let's figure out how to face the challenges, but let's continue to do the things, but it's hard. It's getting harder, I feel like, every day. And I'm still the eternal optimist. I mean, under it all, I'm the eternal optimist that we're going to figure out how to make this work. We're going to go back to helping people in the world and helping rather than hurting and, kind of retracting into ourselves. I would like to see a little more of that attitude in the world. I don't know. I know it sounds idealistic. I totally get it.
Hi, everyone. Welcome back to Unsung Americans, a podcast showcasing the frontline field-based aid work of people who worked for USAID, organizations that were affiliated or funded by USAID, and beyond that, just showing what the work really looked like on the ground. Today, I'm pleased to have Renee Lewis on, old friend, old colleague. We did some crazy stuff together, actually, years back. Not crazy, but risky. Maybe put it
risky.
That way. Risky. Renee, thanks a lot for joining. It's great to have you. Maybe just give you a chance to introduce yourself. Maybe just tell us where you're from and what made you get into this kind of work.
Sure. Hi. Thanks for having me, Alex. I'm Renee Lewis. I grew up in a small town in Kansas, Tonganoxie, Kansas, right outside of Lawrence, born and bred there. And I got into this. My best friend in college, older brother, was a Peace Corps volunteer and came home when I was in college and talked about the Peace Corps. And I decided to join the Peace Corps after college and to travel and to experience living somewhere else and to help people that I knew had a lot less than what I grew up with. So I joined the Peace Corps and was in Haiti. Did you want more?
In Haiti? No. I think that's good. It's funny. We were talking about this, and a lot of people we know or used to work with or have, worked with over the years. The question of why did you get involved in this work? What was it like when you first started out? And you were, especially for people who were in the Peace Corps, for example, it's not really often a conversation, or almost never was a conversation, right? We spent several weeks in post-earthquake Haiti right after that terrible earthquake in January 2010. And it's not like we were having a conversation, hey, why did you start doing this in the first place? It was just like, what else do we have to get done? Who do we have to hire? How many dump trucks do we have? Where the hell is so-and-so? Like, did they disappear? All real questions we were asking. But anyhow, so where weren't you in one thing I do recall, if I recall correctly, you were in a super kind of isolated part of Haiti when you were in the Peace Corps. Is that right?
Yeah. So I was in the very western part in the Grand Anse of Haiti, and it was very remote, no running water, no electricity. I was about an 8-hour hike from the provincial capital, only volunteer up there on my own. Had to learn the language, lived with a family for the first 6 months, and then lived on my own, but did health work up in the remote mountains way out there.
8-hour hike to the closest.
Yeah, sometimes I could catch a ride. There was a road in front of my house that sometimes there would be a truck that would go by and I could catch a ride. And it was about a 2.5-hour ride to get down to the closest big provincial capital. So it was an adventure. That's for sure. And then the closest volunteer to me was about a 2-hour hike from their village to mine.
That's crazy. Yeah. I mean, and I didn't do that. I was not in the Peace Corps, but did my own, not version, but I was overseas, as you know, just like you were again later.
Yeah.
Anyhow, and I know you speak Haitian Creole, so that is part of what ended up connecting us eventually, right? Because we both were in DC, and as I alluded to earlier, or a couple of minutes ago, terrible earthquake in 2010 very sadly killed several 100,000 people. I think was I've seen
it was
very
320,000 or so people. Yeah, I mean it was a high number. So
and I'll tell you just very briefly I'm more interested in you here, but what I remember about that is I think I was in my late 20s, wasn't it? I don't remember. Doesn't matter. I speak French. I spoke French. This earthquake, I had been to Haiti on an assignment and actually especially enjoyed it because Haiti in particular has a very rich kind of vibrant culture, frankly, music, art, food. They have one of the best national beers of all the places I think that I've been prestige. I mean, it's true.
Yeah.
So I had gone and this earthquake happened. And I remember getting the call because the company we worked for at the time was very well equipped to go into a place like this, right? So quickly got a contract from USAID to mobilize and set up a project there, right? And I
Yeah.
remember getting the call and just kind of being like, not knowing what we were walking into. And I remember having that conversation, several of us, because it was you, me, a couple of other people that I'm sure you're still in touch with too. Just all kind of nodding, like, we're going to go, but you can't fly into Haiti. We had to fly into the DR.
Yeah.
But what was going through your mind at the time?
I mean, it was crazy. So when the earthquake happened, I was sitting in a class. I was getting my master's in public health, and I was sitting in a class, like taking one of my classes, and everybody's phone started blowing up, because it was a really big deal at the time. And I just remember kind of being in shock. And then, I mean, the way I always look back on it, within 3 days, I was in Haiti from when the earthquake happened. I remember it was like the very next day at the office, we were all pulled into the conference room and they're like, this is what we're doing. You're going to go in. And I think at first there was just three of us. I don't think you came in right behind, but I think it was Brandon and myself. And I can't remember who the third person is, but we drove across the border from the Dominican Republic and had no idea what to expect. It was not, I'd been to Port-au-Prince multiple times, had no idea what to expect, and just were kind of shell shocked, trying to figure out, okay, how do we get started? What do we do? Our company had an office there that thankfully had stayed standing. And so we had sort of a base of operation to at least start out of, but they're trying to do their thing and we're trying to start up what's actually happening here on the ground. And I just remember it's a very unique perspective. Haven't experienced it before of like, you're starting up this whole thing of trying to deal with what has already happened, figure out how you're going to help the people that are remaining, like what's the needs, how do we figure out how to get the needs they need, nothing can fly in. So it was a pretty crazy.
It was crazy. And I won't hold this against you, but I was the third person. I was in the
Were
first.
you? I'm sorry.
No. And I'll tell you what's funny. One of the things I remember, one of the reasons when we were kind of first we weren't putting the team together. Our colleagues were putting the initial team together in DC, right?
Yeah.
I think you were immediately brought in because you were one of the only Creole speakers, I think, at the time. And you had the skill set to, run operations and set up a project, right? And you knew the country because you lived there you'd lived there in Peace Corps. But I spoke French, so they were like, and the similar thing where else had I done this? I'd done it somewhere else. It doesn't really matter.
I
I
just remember
remember
you had a
saying they
ton
were
of
like, "Oh,
experience in these like stressful situations like this. I mean, because I think you had worked in Afghanistan and done some of those high stress, like,
Pakistan,
yeah, Pakistan, but
Pakistan
I
too,
hadn't
yeah,
experienced that aspect. I knew Haiti and I knew those pieces. So I think it was a really good team to bring together, but I think we were all kind of like, okay, what the hell are we doing?
yeah." Or what's going to happen? And of course, the typical kind of 24-hour news cycle news media. What we realized when we got into country was they were replaying the same
Loop.
footage of some of the pillaging and like looting that had happened, but for the most part that wasn't happening, right? For the most part it was people standing around in shock, hungry, thirsty, having no idea what to do. But I remember us first going in because we had people in the Dominican Republic that were going to take us over the border and drivers that worked on another project, so that we didn't know them, but our colleagues did. And they're like, "Alex, don't you speak some Spanish? Like you can communicate with these guys the way over." I was like, "Yes, I'm conversational, but I don't know it." They're like, "No, that's fine. It'll help because your drivers, the two guys taking you don't speak English." 30 seconds talking to these guys, and I was like, I've never heard that accent before. I'd never spoken Spanish with Dominicans, and I had no idea what they were saying. But um, that was more just at that point, that was comic relief to have something like that happen, right? I thought we were going to be able to, I mean, it was funny. They were like trying to go through me and translate. And I was like, I don't know what they're saying, but I think we're fine here. And we got to the border, and we were told that essentially, like, really be careful and look out, because we don't know if there's kind of, malign actors being opportunistic or taking advantage of it. And again, we got to the border. There was basically no one there. There was no line to get over the border. There was certainly nothing nefarious happening. It was more just people kind of standing around in shock. And yeah, I was like, it's a drive into Port-au-Prince from there, actually quite a ways, isn't it?
Yeah, it was like a 3-hour drive at that point. I mean, we had gone like 3.5 or 4 hours from Santo Domingo, and then it was another 3.5 to 4 once we crossed the border, because the road gets rougher on that side. Yeah. And then I mean, we had no idea what to expect when we got into Port-au-Prince. We had no idea where we were gonna stay, what we were gonna do. Like, our team was still trying to figure out things, and getting in touch with us. I just remember that we were like, "All right, well, this will be an adventure," like, trying to figure it out. All right. So,
I remember all of that, and I remember there's a lot of like logistical details I remember less, for like you said. I don't like, and you also know the distance from the border to Port-au-Prince. Um, what I remember is, and I mean, look, we can talk about what did we actually do there? What was the point of that? What does disaster relief look like, especially in a place where the infrastructure was really bad to begin with. One of the
yeah.
reasons it's so devastating. But what I remember is going into one of the more isolated neighborhoods in the city that people said, this is not a safe neighborhood. We're like, we get it. We get there, and it almost looked, what I recall is that I don't remember that there was actually a visible road to get into the neighborhood. It almost seemed like we were and I don't, again, the details of
Yeah.
this are hazy, but what I remember vividly was when we got to this area that was it was completely leveled. I mean, it was just piles
Yeah.
of rubble and cement. There were just people standing there. And this is now several days after the earthquake, right? And there'd been at least one severe aftershock. There were people just standing there, like, not
Yeah.
almost like catatonic.
Yeah.
And it was seeing places like that where you really were like, not that you really kind of felt the impact. And I hate to say this, but also realizing how many people were buried under all that
So,
rubble.
one of the memories that I hold, and it still shakes me, and if it's too detailed, you can cut this out. But one of the first things I had to do, we obviously came together, figured out, each of us got assignments and sort of went out and were trying to piece together what we needed to do logistically, the work itself, that type of thing. But I remember one of the very first things I was tasked to do was we needed to remove rubble and figure out what locations were the places to start at. And I just remember that I had to go to 2 different schools that were like, the people were buried, the kids were buried, and I had to go and look at them and take a look and, like, can we get trucks in here? How can we do this? And in the meantime, it's sitting there, with the bodies under it, and me trying to pick and choose where we're gonna work. And I mean, it was, and people are standing around in shock, and, we're sitting there, I'm trying to figure out, like, is this the right site? Is this the right, I mean, and it was horrific because, and then it was like ordering body bags and thinking about how we're going to go about this process. And I mean, it was pretty traumatizing for us, but I could only imagine for the Haitians that this has happened to. And they all were scared to go in buildings. I remember that everybody was working outside or standing around outside. Everyone was afraid to go into a building because they were afraid of aftershocks, and they thought we were crazy when we'd enter a building. So, I mean, it was I mean, it was just a crazy time. Yeah.
It
So
was, and
that
I
was
mean, I remember the first guy we hired that same week, he had dug the bodies of his wife and 2 of his 3 kids out of their house, and he had one kid that survived with him, and they were living in his car. And
Yeah.
he started working and moving and setting up that program, which was to, and I remember just around the clock, just kind of thinking, I'm like, how's this guy doing this? Uh, but what we did, you were picking the sites. One of our other colleagues, who was especially good in the under pressure, wasn't he? But he went and found all the available dump trucks. He found
Yeah.
companies manufacturing or distributing work boots. I think got as many shovels as we could buy in bulk. We had matching T-shirts made, right, and we put everybody that we could to work for a small amount of money just to get them back on their feet and moving and clearing all the rubble. And I mean, it sounds like it is just a practical thing. I mean, that was
Yeah.
did
Right. The true cash for work to get, we needed it. It's how you get started. It's what you have to do. So, and we were hiring anybody to help do it. Yeah.
yeah. Um, and I know we did not do this right away, but one of the other things I remember vividly, because then you and I, after we set up the program and I was there for several weeks, I moved back over to the other projects I was working on outside of Haiti. You stayed, right? And I mean, you stayed in Haiti for
Back and forth. I did go back and forth a lot during the first like 6 to 9 months. I was going back and forth to Haiti and coming back to DC. And so, yeah, but it was a lot of that. But I stayed on that project. Yes. And it was interesting to see that project evolve as time went. The things that you needed to do at first when you and I first got there 4 days after the earthquake, totally different 4 months after having been there. So
and then I eventually ended up back on it too. And what I remember, just some of the cool stuff we did, all those containers that had brought like shipping containers that had brought supplies in during the initial post-disaster recovery effort. I don't know who had the idea, but we turned them into schools, right? And, ventilated them properly and
yeah.
did whatever refab needed to be done. But it got kids back in school, among other things. And there was a lot of other cool stuff we did. I mean, we don't need to go too much, but maybe the last question I ask on all of that kind of that time frame was, is there anything else you remember, like the actual work and activities we were doing on the ground that stuck with you or that you felt was especially important?
I mean, I think on that project, we did so much important work. I don't think there was any. I mean, it was all quick turnaround, so it did cost a lot of money, but we were in the refugee camps and we were providing healthcare in the refugee camps. We were providing any information they needed. The schools were a big one, providing, and it, like I said, it evolved. At first it was clearing rubble, clearing bodies, which is horrific work, but it had to be done. It was finding locations, what's salvageable, what can we, work with, how do we get things back up and working. There were a lot of meetings trying to collaborate so that organizations, because there were a lot of international organizations, so we weren't all doing the exact same thing, right? You wanted to make sure each person was sort of covering, or each organization was covering an area. But I feel like almost everything we did, we really thought through of like, okay, is this gonna help the people now or in the next 6 months? Because we couldn't think really beyond that. We were just trying to, get them. And that's what we were supposed to do. I mean, it was a Office of Transition initiative. It's supposed to be that quick, like, how do we get things back up and going? So,
Yeah,
but it was a very crazy time when I look back on it now.
yeah, you're right. It certainly was. One of the things I also remember, we didn't talk about yet, and this is more what I was dealing with, was the government and just basic service providers. They were all in shambles too. They didn't have the infrastructure they'd had before that, et cetera. And I was going around and finding the engineering companies and construction companies and contractors to rebuild the presidential palace and to figure out how to stand the government up and just provide them basis of operations. But in doing that, Haiti at the time was already relatively unstable. We can just kind of call it what it was. The risk of the country destabilizing even more. What is it? A 40-minute flight from Miami, and then you think about just refugees and migrants kind of coming to the U.S. understandably, frankly, trying to escape a disaster. The significance for us and them try to get the government back up and functioning, I think was a big deal, right? Same reason that you were talking about the refugee camps. I mean, our project cleared all those refugee camps and put people into temporary housing. And I believe people on the ground our team on the ground was working with people in temporary housing to make sure they found permanent housing too, right?
Yeah. Yeah. That was part of that collaboration of working. Yeah.
So I guess the last thing on all of this, we could talk about that whole experience and project for a long time.
Yeah.
But why did it matter? What was the point of doing all that?
I mean, the fact that an hour flight from here, and I'm in Fort Lauderdale, Miami area. So an hour flight from here, I mean, I just can't imagine having something like this happen and be so close to it and not help. And I have the skills. I mean, for me personally, I have the skill set to go and do that and to help and to be able to provide something to these people that had lost everything. And I think at the time it was just like I was trying to imagine if it happened to me and my family, like what I would want the help. I would want someone there to help me because I wouldn't know even where to start or how to go about it. And especially in a place like Haiti, like you mentioned, the infrastructure, people don't even know what a stable infrastructure looks like. They've never experienced it. So they have no idea where to start or how to go about doing it. I've always been a big proponent of like the training of trainers program so that you train the people there and that they can do it themselves and I can get out of the way. And so that's sort of my philosophy of like, I wanted to go and help and train those people and then step out of the way and let them lead the charge in their own country and hopefully find better ways to do things. But I don't know how you not help, I guess, would be my answer. I mean,
Yeah,
so
and
many
I'm
people.
obviously I'm not trying to trip you up either.
No,
Yeah,
yeah.
yeah, it seemed clear. So maybe we kind of shift gears and talk a bit more about you've been running Project Medishare, still exclusively focused on Haiti, right? For the last, wasn't it 11 years? Because I remember when you were first
Yeah.
looking at the job, it was when I was coming back from South Africa and Mozambique, which is almost 12,
12
this
years.
12 years.
Yeah.
Yeah.
Yeah. It's been about 12 years.
So
I, you know, I,
what is Project Medishare, and maybe just talk a bit. Yeah, let's talk about what that is and looks like.
so obviously I know a lot about Haiti. And that's kind of been where I focused since I did the Peace Corps. I also, public health is my background. I'm a master's in public health. Project Medishare, they were actually there on the ground. They were the ones that did the tent on the tarmac that was on all the news. And, they went to University of Miami and Project Medishare went down and were the doctors on the ground that were doing the surgeries, that were pulling people out, were flying people to Miami, those types of things. And I knew of Project Medishare from when I was with Peace Corps because we used to translate for them. We were their translators. So the doctor groups would come down and the medical students would come down and Peace Corps volunteers would step in and translate at the clinics and at the mobile clinics. So I had known about them a long time. But so they do community health in the rural setting. And also after post earthquake, they did Port-au-Prince. They helped with the hospital there. So when I came on board, it was about 4 years after the earthquake. So they were definitely more stabilized and, were set up. They partnered with the hospital in Port-au-Prince. And then now in the Central Plateau, a really rural part of the country, there are 2 clinics and 2 maternity centers and a host of community health programs with community health workers that go house to house. So that's sort of what I've been doing. We deliver babies, we do prenatal, postnatal, kind of you do it with health and we do it out there. So, yeah.
Yeah, that's cool. And how has the dismantling of USAID, or has it affected Medishare and your organization?
Yeah, we did receive, we were a subcontract for a program down there for community health, maternal and child health care. And we lost a third of our budget when they shut down. And it was overnight, right? Like it was announced and we got a letter and it said, stop all work. And so we, as an organization, found other ways at the time to keep the work going. We're not going to just stop the work. We're not going to stop seeing patients. We're not going to stop delivering babies, telling our community health workers to stop going out and visiting people's homes. So we kept doing the work, but we've reached it's affected us greatly. We don't have the funds to keep operating. Unfortunately, I think we're going to have to shut down, and that's really sad. It's been over 30 years that Project Medishare has been in Haiti providing healthcare in these rural settings where there's nothing else. I mean, they get no other healthcare. And it breaks my heart because I have kids now, and I think about when my kid gets sick, I can take him to a minute clinic or to the hospital or to the pediatrician, and it's not a big deal. And you get them whatever they need and you go on with your day, sort of. And I think about these families there where a mom has a kid that gets sick and they're not going to be able to do anything. Now they bring them to us, and we can treat them and figure out what's going on. But if we leave, there's nothing.
Yeah.
And, that scares me to think that they'll be an hour from Miami and you're going to have these families that, delivering babies out in homes with no medical help, babies sick, kids sick, malnutrition occurring, and no one to help at all. And it's heartbreaking. So
Yeah.
it affected us a great deal on the ground, and it's still affecting us.
Yeah, it's terrible.
Yeah.
And one thing that, to be honest, has bothered me the past year through this whole mess, dismantling USAID and politicizing it and all of that, and frankly lying about all these people who are lying about what was happening on the ground in these programs. Part of the reason I wanted to do this podcast, to be very honest. One of the things that bothers me when people say, well, there's private money, there's foundations, et cetera. And I'm sorry, but I'm not seeing that happen. I'm not seeing that money get moved. I'm not seeing anyone really stepping in a meaningful way to fill the gap there. And unfortunately, everything you just said is the clearest example to prove that. And I don't know. I mean, it's like I want to ask, well, what's next? Where do we go from here? But I don't think we know that.
Yeah, I don't. It's funny. Haiti has always been a very difficult place to work, right? And I get it. There's all corruption and insecurity and the gangs and all of these things. And it's like a perfect storm. And for many years, I've worked there over 20 years. For many years, I could sort of see the path we need to take to improve things in Haiti, right? And I'd be like, okay, this is the direction we need to go, and this is how we need to get there. Baby steps, but this is the direction. And I think in the past year, I don't know what the direction is. So it's hard to lead when you don't know where you're going and how you're going to get there, and the light at the end of the tunnel. There's always been this light of like, okay, this is how we're going to get there, and there's going to be this, and we're going to be able to find funding here and do this. And what seems to be happening for me is you're right about the foundations. They're still giving money, but now there's so many more organizations that need the money, right? So it's getting
Exactly.
spread thinner and thinner and thinner. So nobody gets what they need. They get a tiny little piece, but it's just not what they were doing. So I think in Haiti, 2/3 of the international NGOs that have been working there have left because they can't stay. I mean, for a host of reasons. It's not just the funding, but that's a piece of it, right? I mean, it comes into it. So, but it's hard. And it's the organizations on the ground that are doing that frontline work that are affected the most. And so it's been hard to watch over the last year. And then, you're pulling at every string you can and searching and like, okay, then how do we make this up? How do we find. But everybody's saying the same thing. Like, I've already given all my money. It's spread. We're in 20 different countries. We're in less corrupt countries, whatever it is. It's been really hard, and it's disappointing, I think, to think we made so much progress. And Haiti made progress. I mean, even all these years after the earthquake, I think a lot happened at the time of the earthquake that put a focus on Haiti. And there has been a lot of progress, but I feel like in the last probably year, it's it's definitely going in the wrong direction. There's not the progress we've seen. And I'm sure it's happening in other places. It's not just Haiti, but
No, that's right. Yeah, I think that's right. I mean, I don't think
Yeah.
that's right. I know that's right. I think we both know that's right.
Yeah.
Yeah. I it's very disheartening, the amount of resources that we have here and the amount that we have that we don't need actually, and then to
Yeah.
still find reasons to say, why are we helping people? Why are we helping neighbors? And never mind the people that I also happen to think we should be helping that are, quite far away, but this may as well be your next door neighbor.
Yeah.
I mean, if someone's got both their legs broken, you don't tell them to just pick themselves up and get them a doctor.
Right. Right.
But anyway,
It's it's tough. I wish I had the answer, but I also think there are a lot of I think they liked the topic of USAID and the deconstruction of it and stepping down, and there's so many different project types, but I do feel like my project is pretty simple. As
yeah,
far as projects go, we're trying to save lives, deliver a baby, healthcare. Like, those are pretty straightforward. They're things that you and I need here in the States. So why would we wanna deny that for anyone else when we can
yeah,
help?
yeah, yeah. I agree. I couldn't agree more. Is there anything else you wanted to, even kind of going back up to 30,000 foot view, anything else about this kind of where we are right now you wanted to comment on or put out there for others to hear? You don't have to have anything. It's just, yeah.
I think this is a that's a hard question. I think that we need to give each other grace. I feel like part of this is the attitude of, like, we're constantly attacking somebody else and finding who's at fault. And I kinda feel like if we just gave each other a little more grace and figured out our own shit, figured out what was, like, what can I do, then maybe there wouldn't feel quite like this, and we could maybe find a few ways forward in different areas and where we're collaborating rather than sort of I sometimes feel like we're all pitted against each other, right? I mean, even looking for funding, you're pitted against another organization because they want the funding. And so, but if you can figure out how to kind of come together and find solutions together and give each other a little more grace and assume people are coming from the right place, I would like to think that that's the way forward and through this, and I'm still the eternal optimist. I mean, under it all, I'm the eternal optimist that we're gonna figure out how to make this work. We're gonna go back to helping people in the world and helping rather than hurting and, kind of retracting into ourselves. I would like to see a little more of that attitude in the world. I don't know. I know it sounds idealistic. I totally get it.
I don't think it sounds idealistic. I still firmly believe most people, I was going to say Americans, but I think it goes beyond that. And interesting thing as an aside, quite a few people listen to this podcast who are not American and based somewhere else on we can see those numbers. So I'm not going to say just Americans, but Americans, and we'll say I still very much think most people would hear what you just said and say, "Liz, I agree with that." And I don't think we should be leaving people out in the, kind of out in the wilderness without basic services. Never mind the reason why that is happening in the first place. Yeah, let's look at that too. But I mean, that's not
Yeah.
a reason to say, well, forget it. I want to buy another electric car. So, you know, whatever. But I think you're right. I think you're right. And I don't know that I'm an eternal optimist like you are, but I'm glad that you are. And I do not
I
find it to be
mean,
idealistic. I don't think that's what it is.
to be working in Haiti for 20 years, I have to be, right? An eternal optimist of like, okay, we're gonna find this silver lining, we're gonna find a way through this, we're gonna, and that's every day I try to think about like, what are the good things we are doing? What are the positives that we are bringing? Okay, let's keep doing those. Let's figure out how to face the challenges, but let's continue to do the things, like, but it's hard. It's getting harder, I feel like every day. But we just gotta the people that believe that, I think, have to keep believing that. That's the issue.
Yeah. Yeah. Well put. Well, I'm glad we have you. Still pushing. On that note, I think I'm going to wrap us up so that we actually, after all the things we talk about, end on something more optimistic and positive. But Renee, thank you so much for all the work you've done, for joining us today. Thank you to everyone who kind of stuck with us through this whole episode and listened all the way through. Please like, subscribe, and share with, especially with your skeptical friends, family, neighbors. Unsung Americans signing out.